The pandemic is complicating medical care for so many people. We're taking a look at the help available for cancer patients managing their pain. We're joined now by Dr. Hemant Kalia, an interventional pain and cancer rehabilitation specialist at Rochester Regional Health. Good morning, doctor. How are you?
Good morning. Thank you for having me.
And thanks for joining us. When the pandemic hit and really restricted a lot of services that we come to know in our area, one thing is for certain, that cancer patients still need help. They still need help managing that pain, and I imagine that was one of the services that was still offered. What adjustments are you guys making during this pandemic?
Yeah, that's an excellent question. I think this pandemic has taught us a lot, and it has allowed us to explore a lot of different avenues, especially when we talk about making some changes in our processes to see patients. I think we have learned a lot about telemedicine. Cancer pain can be debilitating, and I think suboptimal pain control during a pandemic has significant downstream effects on cancer treatments as well. So our primary goal was to continue to provide these services to our cancer patients in a timely manner and in a more efficient manner by using new tools available to us through telemedicine and virtual visits, where we could identify their pain patterns and continue to help manage their pain with the medications, and continue to offer these treatments through those platforms.
Yeah, telehealth has skyrocketed its use since the pandemic began. Describe how cancer patients are getting that help just through looking through a tablet or communicating with their doctor through this technology. What ways are they being treated?
So a cancer patient who's struggling with intractable pain, it's not only affecting their quality of life, but also their function. When they call us with their pain challenges, we actually evaluate them through our telemedicine portal. And if they do need any medications to be prescribed, we can do that through our telemedicine portals. I think some of the changes in the law also allowed us to do that in a safe manner in New York State.
You mentioned that the pain that many cancer patients are living with, dealing with, can be debilitating. Why is it so important, if you can explain, that they don't go untreated? That pain does not go untreated?
So under treatment of pain, especially in cancer patients, can have significant downstream effects, not only on their cancer treatments, be it primarily their chemotherapy, radiation, or surgery, but also this unmanaged pain will compromise success of a comprehensive rehabilitation plan, which is really critical for improving their function and quality of life. So it's really important for us to be ahead of the game and manage their pain in a much more holistic way, in a more patient-centered approach.
Yeah, so doctor, your message to anyone who is living with pain, it's gone untreated for some time and they're just dealing with it, what do you tell them?
So I would tell them to talk with their oncologists, be in touch with their cancer pain doctors, and in some cases, palliative care services are really helpful in identifying these instances early on. So talk to them. There are a lot of avenues where we can continue to manage their pain in a much more safe manner and keep them out of the emergency rooms and urgent care